All right, let's talk about one of the most common and honestly most stressful things you'll see in your pharmacy: childhood constipation. This isn't just a simple tummy ache, it really can impact the whole family. So think of this as your go to playbook for counseling parents with confidence and making a real difference. Let's jump right in.
First off, you need to know just how big of a deal this is. We're talking about an issue that affects an estimated 9.5% of all kids. That's nearly 1 in 10, from tiny infants all the way through the teenage years. So you can bet that every single day you have families walking through your doors who are struggling with this, often feeling pretty lost. Your advice is absolutely crucial. Okay, this right here, this is the core concept you have to get across to parents. This isn't about a defiant child. It's about a very basic human instinct to avoid pain. A child has one painful poop, and their brain says, never again, so they hold it in. But of course, that just makes the next one harder, bigger, and even more painful. Explaining this simple, vicious cycle is honestly the most powerful first step you can take. To help you break that cycle, we've structured this playbook into 5 key parts. We'll start with the problem itself, then move to confirming the diagnosis. After that, we'll build the non-drug foundation, lay out the medication action plan, and finally, talk about how to manage this for the long haul. So, Section 1 is all about understanding the problem. And it really does boil down to that vicious cycle of pain, fear, and withholding. Moving on to Section 2, confirming functional constipation. This is where we get into how you can be sure what you're dealing with, and just as important, how to spot the red flags that mean it's time for a referral. And here's the good news. For the vast majority of kids, the answer is a resounding yes. Functional just means there's no underlying disease or anatomical issue. It's a problem of function, not structure. And the best part is, you can usually diagnose it clinically, right there, just based on the story the parent tells you. No invasive workups needed. So, how do you diagnose it? You use the Rome 4 criteria. This is the gold standard, and it's surprisingly simple. For a kid under 4, you're just looking for 2 or more of these classic symptoms for at least a month. Things like pooping less than twice a week, a history of holding it in, or having painful, hard stools. It's like a simple checklist you can run through in your head while you're talking to a parent. But, and this is a big but, you are the front line of safety. You have to be screening for red flags that could point to something more serious. So keep your ears open for things like the child not growing well, what we call failure to thrive, or a really distended belly, or physical signs like a sacral dimple. Any of those should trigger an immediate referral to a doctor. Okay, on to Section 3. So you've confirmed it's most likely functional constipation. Now the real work begins. And that work doesn't start with a prescription pad or an OTC product. It starts with a solid non-pharmacologic foundation. This is where your counseling skills really come into play. The foundation is built on 4 simple steps you can walk any parent through. Step 1, educate and reassure. Explain that pain withholding cycle we talked about. Step 2, cover the basics, plenty of fluids and fiber. Step 3, help them set up a consistent toilet routine, like having the child sit on the potty for 5 minutes after every meal. And step 4, this is huge, emphasize positive reinforcement. A sticker just for trying to go is way more powerful than any amount of pressure or punishment. And that brings us to Section 4, the action plan. Because for a lot of these kids, especially if it's been going on for a while, those foundational steps need some backup from medication. So let's look at the 2-phase approach that really works. It is so important that parents understand there are 2 distinct phases here. First up is the clean out. Think of it like clearing a traffic jam. The only goal is to get all of that hard, backed up stool out. Once the road is clear, you switch to the maintenance phase. Now the goal is different. It's all about achieving regular, soft, and, most importantly, painless bowel movements. So what's the best tool for both of those jobs? The evidence couldn't be clearer. Polyethylene glycol 3350, or PEG 3350, is your undisputed first-line choice for both the clean-out and for maintenance. You can recommend this with total confidence. So why PEG 3350? Well, study after study shows it's simply more effective than other options like lactulose. Kids tend to tolerate it better with less bloating and gas. It's super versatile. You can use a high dose for the clean-out and a lower dose for maintenance. And the number one selling point, it has an incredibly wide margin of safety. These are all points you can share with parents to build their trust. But what if PEG alone isn't cutting it? That's where stimulant laxatives like Senna or Bisacodyl come in. The key is to position them correctly. They aren't the first thing you reach for.
They are a rescue therapy for tougher cases. A good rule of thumb is to suggest adding one in if a child hasn't had a bowel movement after 3 full days of osmotic therapy. Now, here's a huge counseling opportunity to tackle a common fear. A lot of people, parents and providers included, worry about dependency with stimulants. You can confidently bust that myth. The evidence just doesn't support it, especially when they're used on an as-needed short-term basis. Giving a parent that peace of mind can be a real game changer. All right, our final section, Section 5, Managing the Long Game. Because breaking the cycle is just the beginning. The real goal is preventing it from ever coming back, and that means setting some very realistic expectations. This might be the single most important expectation to manage. You have to tell parents this is a marathon, not a sprint. Success is measured in months, not days or weeks. Even after the child seems totally better, the maintenance therapy has to continue for at least one more full month before they even think about slowly weaning off. Stopping too soon is the #1 reason for relapse. You can also help families by being aware of the risk factors for relapse. Things like being male, having constipation start before age 1, the presence of soiling or encopresis, or having a coexisting condition like ADHD. All of these can signal a tougher road ahead. These are the families that might need a little extra follow-up and encouragement from you. So let's wrap it all up. Here are your key counseling takeaways. Number 1, the parent's attitude sets the tone. No blame, no shame. Number 2, a simple written plan is worth its weight in gold. Number 3, empower parents to adjust the peg dose themselves to find that just right soft stool. And number 4, tell them that relapses will happen. They are normal and expected, not a sign of failure. In the end, it all comes down to this. Your job isn't just to hand over a bottle of PEG 3350. It's to be an educator, a coach, and a source of reassurance. When you empower parents with this knowledge, you become their most trusted partner in breaking this miserable cycle of childhood constipation for good.